Our patients walk in the door and they have no idea how sick they are.
We have a lot of need in our community.
Oh, I think it's very hard to appreciate how many people are really having a hard time.
I've seen a real increase in the demand for primary care.
You know, there are plenty of folks out there who they have a job, they have a family, but still they struggle to find ways to access the care that they need.
The needs are continuing to grow. But one of the things about Hendersonville and Henderson County is no longer that little railroad town.
I just didn't go to the doctor, and I think a lot of people are in that same situation.
Some people will have to choose between buying groceries or going to the doctor.
And so they wait until they're in a hypertensive crisis and show up in the emergency room in crisis. Often they'll generate thousands of dollars in medical bills just from that one visit.
So I think it's greatly important that we maintain Blue Ridge Health Center.
The mission of Blue Ridge is to enhance the health of individuals and families within our community with emphasis on the underserved.
The vast majority of our patients are uninsured or underinsured, but that doesn't mean they're sitting at home. They're going to work every day. They're working in jobs that don't pay them well enough to afford health insurance oftentimes.
There are a high number of people who just don't even realize that there's a place available that they can go. Most of them, if they don't have insurance, just think that they can only go to the ER. So there's a very high percentage of our patients who have not had care in years and years.
And I know a lot of people that don't go to the doctor because they can't afford health insurance.
Money should not be a barrier to care. And so at Blue Ridge we have a slide scale which allows us to discount fees based on a patient's ability to pay. And so that results in affordable care that really is personalized to that patient's circumstance.
A lot of the Medicaid providers are not taking Medicaid anymore, and they have no options. And we're always happy to take a patient here, always. We turn no one away. Everyone is equal, and everyone is treated equally.
Definitely our goal is to build a practice where it is a patient-centered medical home and it's one-stop shopping, where you come in and you see your doctor, you get your prescriptions filled on site. If you need lab work or imaging studies done, you do that on site.
We come here to the clinic because the prices are low, and with our resources, we can't afford expensive doctors.
I had high blood pressure, and if I hadn't started coming out here, my blood pressure would probably been out of this world right now.
And I came, and it was just wonderful the way I was treated.
What a lot of people don't know is what a gem is out here in Blue Ridge Community Health Services. I don't think that they understand the scope. I don't think that they comprehend the vitality and the quality of care that is out here.
I am just so happy that I can look back on the 9 years that I've been coming here, and then also look forward to many more years of coming here.
We don't just provide basic medical care, but we have behavioral health, nutrition services, dental services. We've got the full spectrum.
Nearly 65% of our population are uninsured, and we're in a unique position to be able to provide folks with the primary care that they need despite their insurance status.
How much better could you have it? Quality docs with a heart. I mean, it can't get any better than that.
We have to continue to be progressive in the way that we approach meeting the needs of a growing community.
Blue Ridge Health Center looks at the needs of our community and rises to the occasion to help the community meet them.
And I am very proud to be part of an organization that does as much good work for those people who really need it.
What better place to donate than to a place that is going to help anybody and everybody that walks through the door.
At least a couple of patients a day, I hear how grateful they are that they would have had no other place to go.
You know, the community is all that much better when its people are healthy.
It's a great way to impact our community and enhance the lives of others.
Blue Ridge is a family practice, pediatrics, dental, behavioral health, school health, pharmacy. We really provide everything, and everyone is welcome.
Blue Ridge has been around since 1963, and still there are people in this community that really don't know what we're about. We're available, and we're willing and eager to tell you about the services we provide because we're really proud of them.